Hello, everyone. I'm Ron Rolfing, your host of the ACAP Preferred Education Series, and I'd like to welcome you to our latest session presented by Activate Care. Our presenters today are Linda Dunbar, Chief Strategy Officer, Jenna Barrett, Senior Program Manager, Rich Purcelli, Director of Clinical Programs and Community Engagement, and Caitlin Bowler, Lead User Experience Researcher. And they are presenting the value of the community workforce, challenges and strategies. Before I turn it over, I do have a few housekeeping items I need to take care of. This webinar, along with all ACAP calls and webinars, will be held in accordance with the ACAP antitrust guidelines, and these guidelines can be viewed on our website. We will be recording today's call, and we'll post the slide deck and recording to our website by tomorrow morning. And the link to these items can be found in the invitation sent to you for this webinar. Please remember, if your plan is looking for a vendor, be sure to check out our list of preferred vendors on our website. Just look to the top of our homepage and click on the preferred vendors link. You can also post a note, an RFI, or even an RFP on the preferred vendor connection portal. And of course, during today's session, you can ask a question at any time. You can do this by clicking the Q&A icon in your Zoom window and typing in your question, and all questions will be answered at the end of the presentation. Now, I'll turn it over to Ted Quinn, CEO of Activate Care, to kick things off.
Good afternoon, everyone. Thank you for joining us today. And excited to talk a little bit about a workforce that I think by your participation, we all see as critical in care in the country right now. About 18 months ago, I was sitting in my home office and my 13-year-old son approached me. I was preparing for a board meeting at the end of the year. And he noticed that I was making some comments in the deck about community health workers. And he asked me what a community health worker was. Well, I launched into this profession that's been in existence for decades. I talked about the types of work they do in communities. At the time, I talked about the support they were providing with the COVID response and other types of issues. And I was going through the roles and responsibilities. And very quickly, his eyes glazed over. I noticed he was texting, but I was not undeterred. So I continued to talk about some of the challenges that this workforce faces with reimbursement and financing and the skills that they have and how do they integrate better into care. And then suddenly his phone rang and he had to run away for a meeting with his friends. And so I didn't have a chance to complete that discussion. I've had a chance from time to time over the last 15, 18 months to follow up with him, but he's showed no interest. Well, today I am determined to have a broader discussion about community health workers and their role in healthcare in the country. As we go through this discussion today, you won't hear us talk much about Activate Care, our company, or our platform and program we call Path Assist. We're really focused on trying to share the information, and we're putting on giving the mic, if you will, to folks that have been doing this work for a long time. And so you'll have the privilege of learning from and hearing experts talk about their experiences and the things that they've done to both assess, work alongside, and support care models that integrate community health workers as meaningful and important members of their team. So Linda will kick us off. She's worked for organization for some time, comes from us from Johns Hopkins, and was critical to and a leader in their J-CHIP program, if you're familiar with that, around community health. We'll then turn it over to Jenna to talk about how to think about community work and research in the community to not only understand resourcing and resource supports, but also from the perspective of members or clients, some of the barriers and obstacles they face. And then we'll have Rich talk about different ways to think about community health workers and the models of care that he's been involved with as a clinician and supporting individuals across a range of care needs. And then Caitlin will finish by, as a user experience expert, really she's spent countless hours, or will be spending countless hours, talking with community health workers and members receiving care to be sure that we better understand how we can support such individuals. So with that as context, I'll turn it over to Linda, and thank you again, everybody, for participating. We'll have some contact information if you want to talk more. There's a lot of topics we could touch on today, so we've got to be fairly tight to what we can talk about. But if you want more information, feel free to reach out. So Linda, I'll turn it over to you.
Thank you, Ted. So our topic today, the value of the community workforce. Why is this important for us to discuss? As a nation, we are just rising out of the COVID-19 pandemic, and the public health emergency just ended on May 11th, 2023. But now we are facing another public health crisis, that of a healthcare workforce shortage, which has really been building since before the COVID-19 pandemic. The American Journal of Nursing reports that 4 million nurses will retire by 2030 in the US, and the World Health Organization predicts a shortfall of 15 million nurses worldwide by 2030. But the workforce shortage is more than just an inconvenience. Large swaths of the population that the ACAP Medicaid plans serve do not have enough doctors or nurses to provide them with the health care they need. The healthcare workforce shortages lead to poor outcomes and increased risk of death. So just as the COVID pandemic shone a light on disparities and inequitable health outcomes, so too the workforce shortages disproportionately affect the populations that you serve. Federal and state policymakers are requiring Medicaid and Medicare MCOs to address and measure those disparities and inequities. The burden of that measurement often falls to care providers, hospitals, health systems, and MCOs to assess and intervene on health-related social needs that are identified. At the same time that policymakers are requiring new health equity measures, the federal government has made a $250 million investment to launch CHW training programs to expand the community health workforce to address health-related social needs. Community health workers can be a part of the solution to the nursing and other healthcare worker shortage. CHWs are trained professionals, work in communities to promote health, provide navigation to basic healthcare and social services, and they have a unique and complementary set of skills that enhance existing clinical and care management teams by addressing barriers to health equity. They play a valuable role in bridging a gap between healthcare providers and the underserved populations. Today, you will learn that community health workers are at the heart of Activate Care's Path Assist care model. CHWs are recognized as part of the healthcare, social, and social service workforce in the US. And in 2020, more than 64,000 CHWs were employed in the US. This may actually be an underestimate because of the rapid scaling of the CHW workforce in response to the COVID-19 pandemic. Another national survey has estimated the workforce may be as large as 86,000. The majority of CHWs are Hispanic, Latino, non-Hispanic, white, and Black, and 82% are female. The US Bureau of Labor Statistics has projected a 21% increase in CHW jobs, 13,500 new jobs by 2030, a rate of growth that is much faster than the average for other US healthcare occupations, which is projected at only 7.7%. But while community health workers are essential, valuable members of the healthcare workforce now and in the future, they also face certain challenges. Short-term funding for CHW programs, reliance on grant funding coupled with low wages, around $42,000 annual salary, lack of professional recognition, lack of clear professional paths result in consequent challenges in the CHW workforce. Those challenges on the right of your screen, CHW recruitment, hiring, very high turnover rates, as high as 55 to 77% nationwide, make it very difficult to build CHW programs that have high levels of continuity in providing services to populations like the ones that ACAP MCOs serve. Your members have health disparities and a disproportionate share of barriers to access health and community services. The good news is that addressing CH workforce challenges requires concerted efforts from federal and state policymaker, healthcare organizations, and MCOs and communities. But we must establish and sustain effective CHW programs to meet the needs of communities who are experiencing such disparities, the communities that you serve. Fewer than half of the US states have CHW certifications, but research demonstrates that states with CHW certification programs may expect to see an increase in wages and a reduction in turnover. States have several funding mechanisms by which CHW services can be covered through Medicaid programs, including 1115 demonstration waivers, value-added services through managed care contracting, and shared savings mechanism. So while the CHW workforce presents challenges, there are some effective strategies that can help us address those challenges. So today, you will hear from our Activate Care team about how we are addressing challenges in the community health workforce, and we're sharing 3 components and strategies of our program. One is an essential first step. Prior to deploying CHWs, we do a community assessment which helps build trust in communities that we are serving. The second thing you'll hear from us is about novel approaches to recruiting, training, and retaining CHW professionals as integral care team members. And third, and this is most important and will be the most fun, you will hear from CHWs as we highlight the voice of the CHW workforce in their own words. So we'll look forward to that. I'll turn the microphone over to Jenna Barrett, who will describe the first step, the community assessment process.
Thank you so much, Linda. Yes, so I'm going to talk about learning and trust building at the community level. Next slide. As you likely know, establishing trust within a community is considered a critical piece to providing effective care. Community-affiliated plans often have a long-standing presence in the community and have likely fostered the level of trust and support that's needed to effectively provide care for patients. However, national MCOs that are either entering a new geographic region or even local health plans that want to strengthen their community engagement efforts can follow structured approaches through community assessments to ensure that the voices of those with lived experiences are not only being elevated, but guide their care delivery and pave the way for deploying a successful CHW workforce. So, what is a community assessment? We at Activate Care think of community assessments as formative, necessary work to not only establish trust, but to develop an understanding of the community's unique strengths and challenges to ensure that the local programs and care being delivered are tailored to the needs of that community. Community assessments are typically highly structured, short-term projects that allow for rich quantitative and qualitative data collection and analysis. The most fruitful community assessments utilize a strengths-based approach that seeks to promote facilitators to care, or the elements that help people overcome various barriers that stand in their way to getting their health and social needs met. So the objectives ultimately are to hear directly from diverse plan members with unique needs and experiences, build trust, buy-in, and relationships with the community members and providers, gain information that can ease the efforts of the CHW workforce, and use findings to guide future health and social service programming. Community assessments bring a lot of value to health plans. First, they allow the health plan to develop a stronger understanding of the main drivers of health in that geographic area, as well as the different perspectives, opinions, and experiences held by different people with unique needs and circumstances. Second, they provide an opportunity to hear directly from plan members who all have unique barriers and facilitators to care, which will help you shape your approach to be more tailored, while also showing your plan members that you recognize their unique experiences and you want their care to feel more personalized. Third, it provides a best practice structured approach to engaging both community members as well as other key stakeholders in the community, which can really help build relations and foster helpful collaborations between you and local agencies and community-based organizations. And lastly, it sets up your community health worker workforce for success by giving them a foundational knowledge to work from and a stronger understanding of the diverse community members and providers in the area, which can be especially beneficial to community health workers who might be trained to support specific populations or have a niche focus area. Next slide. So it can be detrimental to make assumptions about a community. Ultimately, what community assessments allow for is for you to learn exactly what the community needs and wants from the community themselves in order to really achieve optimal health and reduce disparities. This will guide your efforts in supporting them and ensuring that you're on target with your approach. Allowing those with lived experience as a platform to have their voices heard and using what they share to shape your programs and care delivery can go a really long way in how they receive and benefit from your services. So on this next slide, we'll show our approach on how we do these community assessments. I want to point out that they can be structured differently based on available resources and needs. And we partner with communities to scope the size of what this assessment can look like, whether that's a full-scale assessment or an abbreviated version with a more narrow focus. But if resources allow, we advise on including key components, as you can see here on this roadmap on the slide. So first, we suggest you form or build on an existing community advisory council of key stakeholders in the area that can weigh in on the approach and engagement strategies that you're using, as well as support dissemination of findings back with community members. We encourage you to review pre-existing published data sets on the community to form a baseline understanding of leading health and social health indicators. Collect qualitative and quantitative data via community-based focus groups, key informant interviews, surveys, or other ways of data collection that have a broad reach and ensure that there's diverse representation, as it's really important that you're hearing from all different types of community members within the population. And lastly, analyzing the results and synthesizing the findings, and ultimately formulating strategic recommendations to improve your programs and services based on what you learned. So this slide highlights some findings on community identified strengths and challenges, as well as barriers and facilitators to care among a Midwest county that we recently supported with a community assessment. As I mentioned before, we find it critical to not only assess and address needs and challenges, but also to assess and leverage a community's strengths and the factors that facilitate or support successful care. It's really important to come at this with a strengths-based approach. As you can see here on the screen, for this community, circled is trust, which emerged as one of the strongest facilitators to care, as well as one of the strongest barriers to care, if not present. We wanted to highlight this because community health workers can play an instrumental role in fostering the level of trust needed to provide effective care. Given their integration into the community and shared lived experience with a lot of the community members, CHWs can often reach clients or patients in a way that other providers aren't always able to do. They can also play a direct role in reducing other common barriers to care and promoting the facilitators. I also want to note that these categories you see are the most salient themes in aggregate among everyone who participated in this particular assessment. However, when broken down by demographics, they can differ quite considerably, which is really important to understand when assessing your unique plan membership and the different subpopulations within it. So one of the biggest reasons to engage community members in assessments and include CHWs in your workforce is really to promote health equity. By allowing diverse voices to be heard and fostering a deeper understanding of the community's unique social determinants of health landscape, including resource availability and accessibility, we can really better equip the community health workers to focus their efforts on supporting those facing the greatest disparities and proactively getting ahead of the anticipated challenges and barriers. Ultimately, these efforts can help close the disparities gap and promote health equity in your community. And with that, I will pass it on to my colleagues, Rich and Caitlin.
Thank you so much, Jenna. So now my colleague Caitlin and I will talk a little bit about what is needed from a tools and resourcing standpoint to fully harness the value of community health workers. So as a quick recap and review, so we've been talking about this idea of community health worker turnover, and we know that we need to focus on strategies related to retention of that workforce. Turnover is disruptive to our programs and particularly to patients and can erode that trust that Jenna was just talking about earlier. So it's an essential starting point as we're thinking about driving to better health. So we want to discuss some of the lessons we've learned that have helped us shape the tools and practices around things like hiring and training and professional development that support our structured intervention of healthcare navigation and coaching led by community health workers. So we'll do this by highlighting some of the important insights that we've gained directly from CHWs themselves, and things like the community assessment Jenna was just speaking about. So we want to start by first recognizing that the core qualities and skills that go into making this role so effective and unique have some commonality. We know that individuals have been serving and supporting their communities for as long as we really have been living in community. This is not a new concept. So there are lots of different titles under the umbrella of community health worker. And there are some core qualities and skills that are common among these roles that we look for as an organization as we're thinking about hiring. So things like a shared experience between the workforce we're hiring and the individuals that are served. And that can be through things like lived experience, a shared cultural or racial identity, or something like a shared diagnosis. We look for the ability to build trust deeply and quickly. Look for deep knowledge of local community. And that can be either a geographic community or the community that individuals identify as a part of. And this can be the difference between understanding that a health resource exists and that that resource is safe and trusted for members of a community. And then things like advocacy to overcome barriers that are driving health inequities and natural skills of empathy, empowerment, and listening. So we'll hear today about some of this work from 3 pretty amazing CHWs who embody these qualities and can share some of their perspective on what's needed to help move this work forward. So I'm going to hand things over to Caitlin to tell us a little bit more about a recent project that she was working on to elevate the voice of CHWs and how their perspectives have kind of helped shape our intervention.
Thank you, Rich. So yeah, I guess earlier in the month, we went out and we were just with the topics and themes that my colleagues have discussed. We were interested to hear directly from community health workers doing the work, what their experiences were out in the field, and to learn from them. So we found these 3 fantastic people and had the chance to speak to them for the better part of an hour. So they're from all over the country in different, slightly different settings, different trainings, but they all, I think it'll become clear, they all they're very experienced and they're really passionate about the work they do. So with that, let me share a video of Senj.
That's what I like to call us. We are human search engines that really just want to help and serve those. And I feel like sometimes we're overlooked and people don't truly respect and understand what we do. And I feel like if people understood and what it's like to be us, what we deal with on a daily basis, I feel like we'll be respected more. I think, the emphasis is more on medical providers, and we're just overlooked also too, because for our profession, we don't have a certification or anything. So of course too, and it also too is just being educated on what it is that we do, because a lot of people don't understand our field of our scope of work.
So it was wonderful to speak with Sen. She brings up some topics that or themes that came up through all of the interviews we conducted, issues around understanding the role, respect, time, and I think Rich is going to share a little bit about how we're thinking about those here.
Yeah, thanks.
That's what I like to call it.
Sorry.
No worries. So what strikes me about that video in Senj is when she talks about being overlooked, and she comments on the fact that she doesn't yet have certification, or the CHW role doesn't yet have certification where she is. Yet we know that this is a unique workforce and has a huge positive impact on individuals' lives, right? But often is misunderstood. So part of what we're doing at Activate Care, we're focusing on measuring the impact of our intervention on things like self-efficacy, health confidence, member engagement and satisfaction, And part of the reason we're doing that is to help demonstrate that this workforce is having a meaningful, measurable impact that we can link back to things like utilization, cost, health outcomes. So when we talk about those core qualities we look for in CHWs, there are a lot of specific techniques that we are training CHW teams to follow and deliver that build on those natural qualities. So things like health coaching, which uses utilizing motivational interviewing or confidence and readiness scaling, identifying goals and barriers and how to move those. Skills like teaching and teachbacks, shadowing and modeling for individuals and clients, and empathic inquiry, all those things that help build confidence, establish relationships and trust. So what's interesting and how we draw the line between what Senj was saying is that all these techniques take time to deliver. And we train our CHWs on how to deliver those, but CHWs are often asked to hold large caseloads, which can somehow be at odds or compromise their ability to impact the change they're asked to perform. So we'll hear a little bit from Caitlin, another CHW who kind of highlights this idea of the challenge of time. And Caitlin, I think you're on mute.
Thank you. You're about to hear from Ernestine, who is out in Central Valley, California, had worked in many different service roles in throughout her life, but it was only in the past 2 years that she had begun working as a community health worker.
That they wanted us to do 150 per, and I'm like, okay, when I first started, I'm like, there is no way. And even when they said 50, I'm like, there is no way, especially if you're doing the actual work. You know, I can call them and pacify them or, you know, barely get by. But I mean, if you're really trying to make a difference and you're really trying to keep them out of the ER and you're really trying to get them to the right care, it's very time consuming. So.
Yeah, I think that's a great example. So part of what we talk about a lot is how do we balance some of the advancements that have been happening. So Linda referred a little bit earlier to some of these great advances that have happened related to CHWs, some alignment around core competencies, diversity of funding approaches, a huge investment in training, and just a basic recognition of this role. And hearing from Ernestine kind of helps enforce that while organizations and plans and health plans embrace a lot of these advances, we want to be careful about over-medicalizing this role or expanding the scope of the role in a way that takes away what's special, unique, and valuable about that experience. So I thought I'd share an example of how we're thinking about that balance here at Activate Care in our Path Assess program. So part of what we're focused on is proactively addressing with partners like health plans, the social determinants of health needs of whole populations. And we've developed a highly structured intervention for our CHW teams, and we'll show you a bit more of that in a few slides. But one of the ways we're serving that large population is by using a set of risk criteria to help stratify individuals into a high, medium, or low touch intervention cohort. And then each of those cohorts has a predefined set of interventions associated with it that matches what the individual might need. So that's part of the structure of our intervention. But at the same time, we also give our CHWs the freedom to use their clinical judgment to help move folks into the intervention cohort that best meets the needs of that individual. And part of that is because we know that CHWs often, through the relationships they develop, have access to additional information that create a more holistic picture of who a person is and what they need in a way that a risk scoring algorithm alone can't achieve. So our investment in training and then the ongoing development and clinical oversight of our workforce helps us have a high level of confidence that we're striking the right balance between that structure and formality and the freedom to give CHWs the power to do what they do best. So we want to hear a little bit from Caitlin next about a CHW and their thoughts on that idea of training and growth.
Yeah, so next, and the last CHW we'll hear from is Diamond, who really, I think, embodies the aspirations that everyone who we spoke with had, and the level of value that they place on training and growth and opportunities for development.
Presented with two offers, they're exactly the same
Mhm.
money, same benefits, same time off. What's something that would set one job off from another?
Okay, Lynn, you already know.
Okay,
Growth.
okay.
Growth. If one of them, if they're both the same with everything, and one is like, well, after a year, what? And then the other one's like, well, we promote within, and if we see you're working hard, I'll go with that one because it shows they actually care. They don't just see me as a number or another worker. So I'm going with the growth place.
Oops. Rich, back to you.
Great. Thanks, Galen. I love what Diamond shared, and I'm so grateful to hear that. It highlights for me that, as more communities hire community health workers, folks are going to have choice in where they want to work. And so as a company, Activate Care, we've really thought about that and developed a specific working group that's solely focused on developing best practices and tools for the professional development trajectory of CHWs. So and we've actually set some pretty aggressive goals to be a preferred workplace for CHWs and focused on things like reducing or increasing retention and reducing turnover. So I want to share a little bit on this slide about the types of tools and toolkits and processes we're thinking about as essential for any organization or health plan or MCO that wants to build a sustainable CHW workforce. So we break this down into two different categories. The first on the top row here is how we prepare our workforce, and then how we maintain and develop that workforce on the bottom. So starting with role definition. The first thing I think about in this category is a really solid understanding of the scope of what the CHW role is. What are the tasks, responsibilities that a CHW will do and will not do? Often I've heard stories about CHWs getting into role and responsibility creep. We want to avoid that so that CHWs stay focused on the work that they're the best at. We think about a lot about career progression pathways. We are currently exploring a lot of different ways to think about a trajectory within the role of CHW that helps keep CHWs invested in the role that often they love, but leave because they can't grow within. So how do we make sure that CHWs can grow within and not have to leave the role of CHW? As we're thinking about practices related to hiring, often if we think back to those skills a few slides ago, we want to think about hiring for the skills and qualities that CHWs have that are going to make them powerful, rather than just being focused on traditional professional experience or formal schooling. And we've heard that directly in some of our interviewing. Even things like when and how you're hiring and interviewing, things like non-traditional interview hours. And then training is a huge bucket for our organization. We spend a big investment of our time and resources in the development of our CHW workforce. So we spend a lot of hours helping train our CHWs before they begin ever working with a client. So this includes training on our structured workflows, on our technology, on the core competencies related to being a community health worker. And it also involves things like shadowing colleagues and a job readiness assessment that both an individual CHW completes to understand if they feel ready to perform their duties, and matched with a supervisor also completing a similar readiness assessment. And then once somebody's job ready, we shift focus to that second level of growth and skill development. So for us, and what we always hope others are investing as well, are things like ongoing training. So we do things like a monthly skills refresher, We do case reviews that are really meant to reinforce skills and give supervisors the opportunity to coach on moving from basic competencies to mastery level, and things like a yearly skills assessment. And we think a lot about how to support individuals through supervision, both group and individual, and how to praise and recognize the work that's happening. And then last, we think about an investment in professional development. So whether that is an investment in support for certification or some sort of licensure, or just learning new skills. So recognize that not all organizations always have the time and resources to invest in this type of support for community health workers. We wanted to highlight them as sort of best practices and highlight how we're thinking about developing out each of these buckets as toolkits that are based on national best practices. Go to our next slide. So the amount of time and energy that Activate Care is really invested in developing CHWs is because of our genuine belief that this workforce is critical and an essential partner to really help us achieve health equity outcomes in our communities. So when we put all this together, we get a high-level overview of the program, which you see here. So our Path Assist program, it's an evidence-based structured intervention, which includes all the elements you see in the green here, things like standard workflows, defined caseload sizes, technology, plus an investment in our workforce, which we talked through. And we believe all those put together will help demonstrate a population-level, measurable health and financial outcomes. So I hope that Caitlin and I were able to give you a little glimpse into the work we're doing and investing in our CHW workforce and how that's been shaped by the valuable insights that we've gained through our community assessments and through individual CHW interviews and some of our user experience research. So I'm going to hand things back over to Linda to help wrap us up and make a few last points.
Thank you, Rich. So in summary, on our next slide, we highlight that CHWs are important professionals to help us address this workforce shortage and the challenges in healthcare. ACAP can drive member engagement and satisfaction when they equip community health workers with purpose-built technology, structured interventions, and ongoing professional development. This requires that health plans, number one, scale this workforce in the face of financial pressures. Two, deliver a different experience and economics for these professionals. And three, tactically address member dissatisfaction and the quality problems presented by poor member engagement. So this concludes our formal presentation. We would love to hear your feedback about our assertions and also answer any questions.
Okay, our first question today. Can you tell us how community health workers integrate into planned case management?
Yes, I can take that. As a former vice president of care management at one of your member plans, I can say that community health workers can play a really valuable role in integrating into health plan care management departments. And they can play many roles: care coordination and navigation. CHWs can work very closely with the care management teams, coordinating care. They can serve as a point of contact for patients, often in the community. They can be in homes and know and see, give feedback to the care management teams about what they're seeing in terms of safety and food and nutrition in the home. Community health workers often perform initial patient outreach and engagement. They can actively reach out to members who have complex health needs. They can provide health education, reinforce care managers' care plans, often support patient engagement and self-management. They can perform initial health assessments and help to contribute to the care plans. CHWs often are great at patient advocacy and support. So, ensuring that patient voices are heard, that your members' voices are heard. They can help patients navigate some very tricky and difficult insurance coverage issues. They can understand a care management or a health plan's care management offerings and make sure that they get connected with the right kind of services. And finally, help with quality data collection and reporting. CHWs can contribute to closure of quality care gaps for HEDIS. They can help with data collection, other data collection efforts within the care management department, monitor health indicators, document patient interactions. So these are just some of how community health worker to help with care management. We do enable our community health workers with technology. They gather information on all social needs in compliance with NCQA social needs and intervention screening. And so that data can be sent back into your systems and supplement your HEDIS submissions.
Okay, our next question. Can you tell us what the benefits of utilizing external community health workers workforce versus hiring your own?
Yeah, I think you heard several of the benefits that Rich talked about in terms of using an external vendor. We have a very rigorous and sophisticated process for community assessment that Jenna and her team and Rich lead. They are community-based participatory researchers who can help with that level of community assessment that really lays the foundation for community health worker deployment. We have community health workers as our main provider of care. And so we're very focused on having experts who are recruiting CHWs, training, and again, the technology, and overall operational expertise, administrative and clinical supervision. So those are some of the benefits. Rich, others, what your thoughts are about the value of an external vendor for CHW deployment.
This is Ted. There are two other things that I would add to that. First, as plans look to either expand into other market segments, either from a geography standpoint or from a plan standpoint, having those professionals to put in place quickly to stand up a program or to support the program in the community is very, very helpful. And the other thing we often hear is if you think about these professionals, and as Linda alluded to, the career track and the support, one of the things we hear over and over again is just the emotional tax and challenge around this role. These are professionals that interface with families and individuals that are going through very difficult situations. And so that support structure and that broader kind of community of community health workers and having those resources kind of in a program and a plan that kind of spans different segments or different plans, we found to be very, very helpful as part of the feedback that we've heard.
Okay, well, that looks like it takes care of our questions for today. With that, I'd like to thank all our attendees for taking time out of their day to join us. I'd also like to thank everyone from Activate Care for a very informative webinar. Just a reminder that the slide deck and recording will be posted on the ACAP website by tomorrow morning. So thanks and stay safe.